now or online?
Yes. Okay. All right. So, as you can see on the slide there, I spent my first 10 years of medical practice chasing numbers. I watched with dismay as on the charts every week, the patient's body weight would be going up, as with their blood pressure, their blood sugar, their inflammatory markers, and following right behind were my increasing doses of prednisone and insulin and beta blockers. And I got to get very discouraged because despite my best efforts, I'm getting calls from the emergency room that Joe's in with chest pain and Mary's in with a stroke. I felt like a failure as a physician. I came to understand why so many of our colleagues are leaving medicine. After I had a few epiphanies into the underlying causes of their diseases, I founded our nonprofit Moving Medicine Forward initiative. And for the past 4 years, I've been going to the nation's medical schools and talking to the medical students and young interns and residents, young physicians that want to reach them before pharmacosclerosis sets into their brains, and they think that drugs and surgery are the only treatments for the illnesses they're seeing. And I've been telling them, no matter what you learn in medical school about diagnosing everything from smallpox to leprosy, when you get out into the real world and you open the door of the waiting room, in any clinic, if it's your own family practice, but in the emergency room, surgical outpatient, GI scope outpatient, doesn't matter. When you open the waiting room door, who's waiting there to see you? You're going to see a large group of people with a small group of diseases. No matter what these specialties are, their patients are going to be statistically overweight, if not clinically obese. You're going to see florid atherosclerotic vascular disease showing up as claudication or angina, runaway lipid values, uncontrollable high blood pressure, or at least a significant high blood pressure, florid type 2 diabetes, and a host of inflammatory diseases affecting every organ system from lungs to gut to joints to immune system. Welcome to Western medicine in the 21st century. Mr. and Mrs. America are waiting to see you. And in general, not all these patients, but in general, most of them have some elements of being either overweight, hypertensive, atherosclerotic, insulin resistant, and inflamed. This is Western medicine in the 21st century. These are the patients that we have to deal with. And I know what the standard approach is, but I learned a different approach when for 8 years I served as an attending physician at True North Health Center in Santa Rosa, California, about an hour north of San Francisco. And there we had the same river of patients with their classic maladies, overweight, hypertensive, diabetic, clogged up, and inflamed. But in these people, it was a residential facility. People came to stay for a week, 2, 3, 4 weeks or longer. And instead of just raising their doses of insulin and beta blockers, what we do is put these folks on a diet of whole plant foods. Every morning there was a big pot of oatmeal with lots of fruits and berries, nuts and seeds to put on it, with a variety of plant milk, oat milk, hemp milk, rice milk, almond milk. And every lunch, every dinner, he had big colorful salads, hearty vegetable soups, big plates of steamed green and yellow vegetables, and a variety of entrees that we want them to eat to their heart's content. There's no calorie counting, no carb counting, but we had large trays of no cheese burritos and no oil stir fries and curries and soups and stews and chilies, and lots of colorful fruits for dessert. This was the food stream that disappeared down these people's gullets, meal after meal, day after day, week after week. And the changes we saw in these people were nothing short of spectacular. Within days, the obesity begins to melt away. It doesn't magically disappear, but they lose good 2 pounds a day for the first couple of weeks, then drops down to about 1 pound a day until they achieve an ideal body weight. The artery walls begin to relax and dilate, so blood pressures come down. We start lowering the medication they're on. This is Carl, came in looking like this, and 18 months later, sometime in the gym, Carl winds up looking like this. In fact, I didn't mention that Emily here came in not only overweight, but on 30 units of insulin for her diabetes and 2 hypertensive medication, 11 months on a diet of whole plant foods. This Emily turned into this Emily, and she not only lost the weight, but she lost her hypertension, diabetes, and the medication she was on. As I mentioned, Carl took him 18 months and some sweating in the gym, but he turned this body into this body with all the lovely fiber in the vegetables and the fruits and the resistant starches in the beans. These folks have their first good bowel movement in years, and it improves their outlook on the whole universe. Here's Philip. Came in looking like this, and 18 months later, this Philip turned into this Philip. And he came in with eczema and a little touch of psoriasis. Those cleared right before our eyes. He also was troubled by bronchospasm and asthma. He stopped using his inhalers. Here's Ali, came in with hypertension and metformin for his insulin, for his glucose intolerance. 14 months on a whole food plant-based diet. This Ali turned into this Ali, sleeping better, and was able to get off his medications. I laugh, I chuckle at least on TV when I see the weight reduction program. I see the little tiny crawler underneath that says, "These results not typical." Well, these results I just showed you are typical. This is what we expect to happen. This diet, this food is mostly whole plant foods, which are largely fiber and water. Their calorie density is so low that people naturally get leaner despite eating ample portions of these delicious foods. Now, what we're talking about is the phenomenon of disease reversal, and this is not a California woo-woo term. We're talking about remission of clinical symptoms. The lungs stop wheezing, the joints stop hurting, and also normalization of their laboratory results. Their inflammatory markers improve, their lipid panels improve. This is disease reversal, and we see it on a regular, predictable basis. And as I became a student of the effects of plant-based diets on the human body, I began looking in the medical journals, and every month it seemed there would be some article showing the effectiveness of plant-based diet in reversing, at least improving significantly, if not absolutely reversing, these 9 diseases, which really constitute the majority of clinical conditions that most physicians spend their office time treating. The arteries diseases, type 2 diabetes, obesity, hypertension, etc., but also the inflammatory diseases, including lupus and various autoimmune diseases as well. So the question, and what I owe you in this presentation, is why does this work? How does this happen? What are we looking at? How does food have this effect on the human body? Let's explore some of these concepts. And I wish when I was a medical resident or a young attending doc, some chief resident, some professor sat me down and said, "Look, in a few minutes you're going out to outpatient, and you're going to see this river of patients, overweight, hypertensive, diabetic, clogged up and inflamed, who are going to want you to do something, say those magic words, get them on the therapy, to restore them to radiant health again. What are you going to tell them, Doc?" Let's have a real honest to goodness talk about what it is you are seeing when you see these patients. And again, to the viewers, I must admit, be prepared for some concepts that are potentially disruptive to your concept of what's happening in the body with disease. But it's time that we had an honest discussion about these very powerful factors. Just some comparative anatomy here, the physiology. We have to recognize that the biggest, strongest, most powerful animals on planet Earth do not eat meat. Elephants and buffaloes and giraffes and gorillas grow to spectacularly muscular bodies without ever eating cheeseburgers or pepperoni pizzas. And along with that, we have to recognize that no advanced primate, no gorilla eats animal flesh either at all. The occasional termite or beetle goes down with their leaves and fruits. But they certainly don't eat animal flesh 3 times a day. They don't feed their young animal flesh 3 times a day. We have basically the same digestive anatomy that the gorillas do. But do we take their example and eat a diet of whole plant foods? Not so much. Most Americans subsist on a diet that's evolved into cooked animal muscle and dairy products with an overlay of excessive salt, sugar, and seed oils, and processing chemicals. And my proposition to you is that this food stream is the main driving force behind much, if not most, of our chronic disease process. Now, this might be new to you, but I humbly submit this is not a subtle process. Its fingerprints are visible to the naked eye. Now, let's compare. And this is what I wish the professor, the chief resident, said. If you eat a meal of whole plant food, your nice vegetable soup, big salads, sweet potatoes, steamed veggies, etc., you have a meal like this. And if an hour later I were to sneak up on you with a needle and a syringe in my hand, and when you weren't looking, I put 5 cc's of blood into a glass top, red top tube, let the blood clot, put it into a centrifuge and spin it down. And I took the tube out to look at it. What will we see? Of course, we would see that the red clot goes to the bottom, and the liquid part, the serum, is sitting on top of the red clot, is crystal clear. You can read newsprint through normal serum. This is what your blood should look like after you eat a healthy plant-based meal. It's low in oil, low in fat. But if you have a standard Western diet meal, you have bacon, eggs for breakfast, a cheeseburger for lunch, fried chicken for dinner, a bunch of dairy products, and you draw that same 5 cc's of blood into the glass tube, what you're going to see is a tube that looks like this. There's milky appearance on top, of course. This is a postprandial-like penis. There's fat in the blood. The fats, we're mostly looking at triglycerides and saturated fat with some cholesterol. It's largely the fat of that the person just ate. Now, I admit not everybody shows the fat is optically densely, but everybody has a wave of fat that goes to your bloodstream after you eat a fatty meal. How can you not? Where is it going to go? And your blood stays this fatty for 5 hours. There's a classic study. They gave someone a fatty meal at hour 0. They drew blood once an hour for 6 hours. They took those 6 blood tubes and put them one after another into a spectrophotometer to see how fatty the blood is getting. You can see the blood getting fattier and fattier and fattier. It takes the liver 5 hours to begin to clear the fat out of the blood. And during this time, the arteries are getting injured, the abdominal obesity is increasing, insulin receptors are getting clogged up. I'll show you more about that in a minute here. But this is not a benign process. And because hunger is not tolerated in our society, if you're at all hungry, if you're at home, you put your head in the fridge for last night's dinner leftovers. If you're out and you get munchy in the tummy, you head for the nearest restaurant or convenience store. And the fact is, in our affluent country, most people are keeping themselves in the postprandial state all the time. When you open the door of the waiting room, most people have just eaten something in the last hour or two, and most of your patients have blood that looks like this. Now, we have focused on the fat in the blood because it's the most visibly obvious, but there is more than fat in this blood. What happens after you eat a cheeseburger, fried chicken, or order buffalo wings? What floods through your bloodstream, what floods through every tissue, every cell in your body is what I call the postprandial red tide that predictably carries these 16 contaminating toxic molecules, if you will, dramatic descriptors. But let's just quickly go down this list. You're going to obviously have saturated fats, which are pro-inflammatory, which fans the inflammatory reaction throughout the body. The excessive salt not only stiffens the arteries, raises blood pressure, sets the patient up for congestive heart failure. We're now knowing that high salt diets stimulate T17 helper cells that open the door to lupus and autoimmune diseases. Who knew? All the sugars that are in everything from the cakes and candies and soft drinks to the ketchup to the white flour buns stick to proteins. They glycosylate proteins all over the body, produce advanced glycation end products teeming with free radicals. Fragments of the animal muscles leak into the bloodstream through the intestinal lining and flow through joint membranes, stimulate immune cells, setting off autoimmune diseases. Lots of free radicals produced from frying the chicken and grilling the burgers, and those rip electrons off your proteins, off your cell membranes. Just cooking meat produces advanced glycation end products teeming with free radicals. The emulsifiers, the polysorbate 80s and others that keeps the candy bars nice and soft and gives ice cream that nice mouthfeel, dissolves mucus in your intestinal lining, increasing gut permeability. The fact of grilling the burger, frying the chicken, boiling the steak oxidizes the cholesterol in the animal's muscle as the oxidized cholesterol particles that I'll show you in a minute that are the most atherogenic that work their way into the walls of the artery, setting off plaque formation. Endotoxins from the slaughterhouse bacteria that are on every cutting surface. They coat every steak and chop and chicken breast that leaves the meatpacking plant. But as these bacteria die and break apart, their cell walls release this nasty lipopolysaccharide called endotoxin that not only releases histamine and free radicals, makes your blood clot, depresses the myocardium, and it's heat stable. Grilling a burger does not get rid of the endotoxin that's already inherently in the meat. And so our paleo eating friends and our keto eating friends are giving themselves a shot of endotoxin 2-3 times a day. Trimethylamine oxide is produced by the bacteria in the gut that are summoned up by a meat and egg-based diet. The carnitine and choline become transformed to TMAO that drives cholesterol into the artery walls. You inevitably are going to produce carcinogenic heterocyclic amines that smear on the stomach wall, giving gastric cancers, the colon wall, giving GI cancers. When you flood the liver with amino acids from all the protein a person's eating, the liver responds with a surge of insulin-like growth factor 1 that fans cancer growth throughout the body. Heme iron makes red meat red, but it increases the risk of strokes and cancers. Don't have time to go into the mechanism of it. Grilling the burger, frying the chicken oxidizes the glycogen and the nucleic acids in the animal muscles, and that's going to create reactive aldehydes like lactylactylene. They damage your genes. You're just having lunch, but meanwhile, you're flooding your DNA molecules with substances that actually damage your nucleotides. U5GC is an inflammatory sialic acid that only animals make. It fans inflammatory reactions throughout the body, and our paleo friends are giving themselves a shot of U5GC with every meal. And the animals in the feedlot are fed bushels of grains that are sprayed with herbicides and pesticides. They drink water with cadmium, mercury, lead in it. They're given hormones and antibiotics as growth promoters. All these substances accumulate in the animal's flesh. So every burger you bite into, every chicken breast has the bioconcentrated molecules that have accumulated in the animal's flesh throughout its life. These are just some of the molecular marauders from the standard American diet that flood through your tissues hour after hour after every meat-based meal. It's a fatty type, it's a salty type, it's a sugary type, it's antigenic, as I mentioned, it's full of phosphates and sulfates that create phosphoric and sulfuric acids that have to be neutralized by your kidneys and your bones. As I mentioned, it's mutagenic, it's carcinogenic, atherogenic, pro-inflammatory, disrupts enzyme reactions throughout the body. And not only are these molecules hazardous on an individual level, but they're all in your bloodstream at the same time after you eat that cheeseburger and fries and a shake, or after you have the chicken breast dipped into the dipping sauce, etc. And that sets up some malignant synergies. I'm going to talk about 2 of them, but these substances interact with each other and with the body system. Endotoxin, I mentioned, nasty stuff, depresses your heart muscle, fans inflammation, makes your gut leaky. You sure don't want endotoxin leaking into your bloodstream. And again, steaming broccoli does not create endotoxin. Cooking oatmeal, boiling rice does not create endotoxin. This is from animal-based products. You don't want endotoxin flowing into your gut, into your bloodstream. What might increase the absorption of endotoxin? Saturated fats. Well, where is the endotoxin found? It's in these nice juicy burgers. What's making the burger juicy is all the saturated fat that is in the burger. And again, so there's a synergy that really works against the person eating the Western diet. And if you do the math, if you're eating 3 meals a day, that's over 1,000 times a year, flooding the red tide through your tissues day after day. And a steady diet of standard American diet fuel that we mentioned has these characteristics. inevitably sets off inflammation and organ dysfunction until finally you get a disease put on it. Oh, you've got lupus, you've got hypertension, you've got type 2 diabetes. But if you're putting diesel fuel, putting kerosene in your gasoline burning engine in your car, you're going to be shocked when the engine dysfunctions and starts belching black smoke. Well, our metabolic engine is going to dysfunction as well. And so to the clinicians out there, so when you open the door in clinic to go in to see your patients, when you see the man with the angina from his clogged arteries and his coronaries, you see the asthmatic woman pulling on her albuterol inhaler, you see the man with type 2 diabetes injecting insulin, you see the woman grieving over her acne-scarred skin. You look in the books or you ask your professors, what's the cause of these diseases? Etiology unknown. We don't know the cause of hypertension. We don't know the cause of type 2 diabetes. And it's true, we've not teased out every last interaction between every gene and every enzyme. There's a world of discoveries waiting to be made on that level. But to say we don't know the cause of these major degenerative diseases that are basically 20th century diseases that evolved as our diet became more and more based on animal products and processed foods. To say that we don't know, to me, ignores this very large and smelling elephant in the room. It comes down to this equation at the bottom: food effects over time equal to health effects. And it's time we had an honest look. And it's been a taboo subject. Who has culturally don't want to talk about the patient's diet. But doctor, that's why the patient is sitting in front of you with the body that they have. And we really have to get real about the effects of their daily diet on their physiology and their diseases. So finally, you get the patient in the office who wants to change. He got out of the shower a couple nights ago, caught a look at himself in the bathroom mirror, did not like what he saw, did not like his big protuberant abdomen, did not like his sore, swollen joints, did not like a medicine cabinet full of pills. And so I got to change something. I got to do something different here, or I'm going to get very, very sick. So he's in your office saying, doctor, tell me what I need to do. Whatever you say, doc, I'll do it. I got to get my health back. What can I do? Hopefully, as your therapeutic armamentarium broadens after this presentation and the studying that you'll be doing on the subject, I humbly submit that the most powerful life-enhancing advice you could give this person is start consuming a food stream made of mostly whole plant foods, like we showed you at True North: the oatmeal and fruit for breakfast, the soups and salads and stewed veggies, etc. Run this food stream through your body meal after meal after meal, and let's see if you don't get some very beneficial changes very quickly. And the patient says, that's nice, I have no clue how to do this. Fine, just tell, listen, off Amazon, you can download onto your cell phone this lovely little book by Rachel Brown called For Fork's Sake. It's a skinny little book. You can read it in a couple hours. And she takes you by the hand and says, here's what you need to do to put a plant-based meal together. Here's what to shop for at the store. It's simpler than you think. And again, it's not that revolutionary. You're probably eating this already, but oatmeal and fruit for breakfast, lunch, a soup and salad and sandwich, a hummus sandwich, and bean chili, and some fruit for dessert, and dinner, pasta with veggies, lentil stew, and curries and greens. There's no end of healthy foods that are easy to make. I invite people to go to my website, klaper.com, and download my healthy eating guide. So the patient does this. Let's talk about the effects this now has in their body. So here we are, the person's still eating the red tide foods here. And here are those 12 molecular marauders flooding through the tissues of every meal, causing disruption and disease in every tissue of the body. And the person says, I'm done with that. And they jump onto the plant-based train, 100% full tilt, boots in, like they say in New Zealand. And I realize your patient may not do all that immediately, and any step they take, just having a salad every day helps. Just eating 1-2 less burgers every week will help. Just the more they move to that direction, the healthier they're going to be. But let's just talk some physiology. Let's say the person really has gone full tilt, and you can do it overnight. I did it overnight. You can do it. To go to a whole food plant-based diet. What happens in the body? The first and foremost and most important change that happens, the red tide stops. There is respite. Every tissue in your body, every cell in your body has repair mechanisms built into the DNA instructions. Every cell knows how to repair membranes, to restore cellular harmony and function in the tissues, but they can't do these repair mechanisms can't function optimally if every 4 hours there's a red tide surge coming through, bringing in free radicals and HEs and phosphoric acid and high fructose corn syrup, all those marauders. Now that stops. Do you know, you probably do as your health professionals, but I was delighted to know that in every cell in our body where our DNA strands lie unfolded, exposing our genes, we have proteins, we have DNA editing enzymes that spend all day going up and down our DNA strands looking for damage to the nucleotides, looking for nucleotide mismatches. And when they find them, they fix them, they repair them. But they don't ask your permission. They repair your DNA. But they can't do their job optimally if every 4 hours you're flooding the red tide through your cells. So now these cells and repair mechanisms get to function fully. The red tide has stopped. And these molecular marauders are now replaced, not by the red tide evil molecules, if you will, but now an entirely different set of molecules are flooding through the tissues with every meal. First of all, it's a high water content diet. All the soups and salads and steamed veggies and fruits are full of water. And as a result, the water floods into the bloodstream and the blood becomes less viscous. When you eat a meat-based meal, the saturated fats coat the red cells, they become stickier, the blood becomes more viscous. It doesn't move through capillary beds as easily, doesn't distribute oxygen and nutrients as efficiently as it might. Well, now the blood is much more free flowing. When they look at the blood viscosity of vegetarians versus the omnivores, there's no question that folks who are plant eaters have significantly lower blood viscosity. So the blood is more free flowing. That works very well with another effect having to do with the fact that the dark green leafy vegetables the person is now eating is going to increase the production of nitric oxide in the walls of the arteries. That's going to let the artery walls relax and even dilate a little bit. Well, that little vasodilation is very important due to a law in physics called Poiseuille's law. Poiseuille's law says that even a small increase in the diameter of the artery is going to mean a significant increase in blood flow. And you know this as well. If you try and suck a liquid up through a skinny straw, a straw just twice the diameter delivers a whole lot more liquid. The flow goes up by the fourth power, the increase of the radius. Don't worry about the actual number, but you get the sense that what's happening is now these arteries open up. There is now a surge of this more free-flowing blood flowing through the capillary beds, delivering oxygen and nutrients far more efficiently to all the tissues in the body, heart, brain, muscles, etc. When you pull the animal flesh out of the diet, you're also pulling out the arachidonic acid, which is the main driver of inflammatory prostaglandin production. And now all the fats are coming from plant oils, many of which are in the omega-3 family, which have an anti-inflammatory property. And as a result, you've changed the entire inflammatory balance to tissues throughout the body, from a pro-inflammatory one to an anti-inflammatory one. This works in tandem with the fact that all these colorful fruits and vegetables, what's making them colorful, of course, are the antioxidant phytonutrients that flood through the tissues. And if there are free radicals in the tissues, these antioxidants quench them. They donate electrons and quench the free radicals. So the oxidative stress in the body is going to be decreased tremendously. You've changed the tissue milieu of every tissue in the body. If you change the food flowing through the intestinal tract, you're going to change the microbes that live in that intestinal tract. If you're eating a meat and dairy-based diet, you are fostering the growth of some nasty pathogenic organisms from the Bacteroidetes family, and their byproducts are pro-inflammatory and make the gut leaky, not friendly fellas. But when you pull the meat and dairy out and stop nourishing the Bacteroidetes microbes, now what you're fostering the growth of with all these resistant starches, etc., are the families in the Prevotella phylum, and they are far more friendly microbes. They put out anti-inflammatory substances. Not only that, but they put out neurotransmitters like dopamine and norepinephrine and oxytocin. These are feel-good chemicals that get into the brain, through the blood, through the vagus nerve. And people notice, yeah, I'm feeling better since I changed my diet to a plant-based one. That's not a placebo effect. That's a gift from your refurbished microbiome. When you stop eating other animals' cholesterol, your own lipids are going to become less atherogenic and less likely to cause plaque formation. The fats that work their way out to the skin are now coming from plants, and guys notice that their body odor often clears up. Their wife comments with pleasure, and again, changing the fats and diet will do that. Hormone levels change. The cows in the dairy have been genetically modified. The American dairy herd has now been GMO'd, so they will give milk even though they're pregnant with their next calf. Normally, biology has them dry up when they're carrying their next calf, and there's a good reason for that. Well, the dairy producers can't tolerate their best milkers going offline for 9 months while they're carrying their next calf. So they've had their dairy herd genetically modified. So now dairy products are made from milk sucked off of large pregnant bovines. And as a result, there's a significant amount of estrogens in dairy products. And these are not the puny little phytoestrogens from soy products. These are official mammalian estrogen. This is estrone, estradiol, estriol, pregnanediol, progesterone. These are official mammalian estrogens that give women breast lumps and fibroids and makes them bleed into anemia. It gives guys man boobs. It makes the prostate gland unstable, opening the door to prostate cancer. Well, that all disappears when you stop consuming dairy products as well. Renal function will improve. High protein diets are not friendly to the kidneys. When all those amino acids hit the glomeruli, you're going to get more. It forces the glomeruli to go into a state of hyperfiltration, which leads to chronic kidney disease. Again, the asthmatic folks find their lung mucus is less viscous, so they use less albuterol. The immune cells get more efficient, so you need fewer white cells. These are just some of the changes that happen in all the tissues of the body with the change from an animal-based food stream to a plant-based food stream. So if someone were to ask me, doctor, in a word, what changes in the body when one does go from an animal-based food stream to a plant-based food stream? What changes? In a word, everything changes. It's an entirely different physiology. It's a different biochemistry. The extracellular fluid, the intracellular and organ function, blood viscosity, the microbiome, the changes are profound and elemental. I could spend 2 lectures going through each of these organ systems, showing the beneficial effects of a whole food plant-based diet. Can you get enough protein? Absolutely. 3 meals of basic whole plant foods can easily give you 80 grams of protein or more. We're running short of time here. I'm going to quickly go through how the changing to a plant-based diet can reverse atherosclerotic plaque in cardiology. We need it because every 40 seconds in this country, 1,000 times a day, 380,000 times a year, an American grabs their chest and falls over the heart attack and dies because a plaque in the coronary artery has torn open, initiated a clot that stops the blood flow distal downstream and infarcts heart muscle. How did this happen? Is this a statin deficiency? No. The endothelial linings are injured. How did they get injured? Well, of course, it's running a red tide through the arteries every 4 hours. All the free radicals and AGEs, et cetera, tear up the endothelial lining. And then there's oxidized cholesterol, which is really important. Sorry for the biochemistry here. But cholesterol is not an evil molecule. Your liver is making it for hormone production and membrane synthesis. But but it's easy to oxidize cholesterol, easier than oxidizing steel. And when you rip electrons off the cholesterol molecule, you wind up producing cholesterol peroxides, and these are the atherogenic particles. And just storing meat in the fridge it will oxidize, but certainly grilling the burger, broiling the steak, frying the chicken oxidizes the cholesterol. And here's the artery wall here, and you can see the oxidized cholesterol getting into the wall that gets engulfed by the foam cells, and that leads to plaque formation. And here's where another malignant synergy kicks in. Here's the cholesterol in the meat being oxidized by the cooking. It gets absorbed, finds its way in the arteries, but now the endothelial lining, that's all been already damaged by the fried food and the uric acid and the AGEs. So the cholesterol oxidized by cooking has its door opened by the other red tide foods to get into the walls of the arteries, which leads to plaque formation. And because the person's eating a pro-inflammatory diet with lots of prostaglandins and AGEs, et cetera, the plaques start getting bigger and bigger until they finally tear open. And here's another incidence of the asymmetry because the burger and the chicken fat that the patient has eaten makes their blood more viscous. It's more thrombogenic. It's going to clot more aggressively. So once that plaque tears open, his more thrombogenic blood is going to set him up for a lethal heart attack. Most cardiologists, oh, this is a relentlessly progressive disease. They're all going to need stents. They're all going to need yes, doctor, if you don't talk to them about what they're eating, that's exactly what you're going to see. But it doesn't have to be that way. This is actually a reversible disease, as Dr. Caldwell Esselstyn has shown in his research. Landmark study followed almost 200 men, all with bad coronary disease, put them on his plant-based diet, and followed them for 4 years, expected 60 of them to have a major adverse cardiac event, sudden death or heart attack or MI or CVA. How many had these MACEs? None, essentially. And those folks who came in with angina, 9 out of 10 of them had their angina go away. So what is Dr. Esselstyn's program? Basically, it's a whole food plant-based diet, but he also wants you to eat a helping of greens, some kale or broccoli, a few times a day. Why does he recommend this program? Well, first of all, the most important thing is that the red tide stops. It's 100% plant-based. Again, you don't generate oxidized cholesterol by steaming broccoli or boiling rice. So the red tide stops. But the bolus of kale or broccoli in your intestines every few hours acts like a time release capsule that's constantly letting antioxidants seep into the bloodstream. And week after week, these antioxidants work their way into the walls of the arteries. They neutralize the free radicals. The foam cells outmigrate. And as a result, the plaques get smaller and smaller and smaller. The endothelial lining, as was damaged, reestablishes itself, not by magic, but because the bone marrow is constantly putting out showers of stem cells that reupholster the artery walls like new paving stones. And as a result, you get these dramatic improvements. Here's a left anterior descending artery. The entire artery should be approximately this wide going down. But these red-eaten portions here, as you know, are atherosclerotic plaques encroaching into the blood flow channel. This man went on a whole food plant-based diet and soup and after salad, after steamed veggies for 29 months. The plaques melt away, and this artery turns into this artery. Again, same artery, same patient. Look how reversible this advanced plaque disease was. And again, as those plaques melt away just a little bit, guess who kicks in? Brazil's law has its effect. So even if the plaques melt away a little bit and the artery walls dilate a little bit, you get big increases in blood flow. Here's a cardiac perfusion scan. Red is good blood flow. You can see how choked off the blood supply is. But he went on a whole food plant-based diet. And after just 2 weeks, the plaques melt away a little bit, the artery dilates a little bit, Poiseuille's law kicks in, and this perfusion scan turns into this perfusion scan. People get dramatic improvements within weeks. I saw this report in 1977. A 65-year-old man with severe angina had to stop every 10 paces, went on a plant-based diet. 6 months later, he's climbing mountains in the Lake District of England. Arteries all over the body opens up. Much to the delight, I'm sure, of this woman, who's very happy that his retinal arteries are delivering more blood to his optic nerve. It's hard to open a medical journal these days without finding some article showing how plant-based diets have these very profoundly positive effects, certainly in vascular issues, angina, claudication, etc. But even hypertension, heart failure, even renal failure will improve as the renal arteries open up, GFRs increase, the creatinines come down. How exciting. What great news for the nephrologists who watch their patients steadily march downhill on the standard Western diet. This forces the doctor to learn a delightful skill that no one mentioned to me in medical school called deprescribing. You've got to learn how to get these patients off these medications. You've got them on powerful hypertensive medications. They'll stand up and their blood goes down to their boots and they pass out on you. You have to get them off these medications. The lifetime medication, nonsense. Same thing with insulin and diabetes. Oh, once on insulin, always on insulin. Nonsense. Not only can you get them off, you have to get them off. So how exciting to see this concept, disease reversal in cardiology. Now, many of the cardiologists out there may say, yeah, it's all very nice, doc, but I don't have time to talk about this. I don't know. I got a waiting room full of patients. It's easier for me to give them a prescription for statins and a shot of Repatha, and don't bother me, I get the cholesterol down that way. Yeah, you can do that, but a couple of things, doctor. The absolute risk reduction from statins is very modest because they don't deliver to. Atherosclerosis is a complex condition. It involves inflammation and insulin resistance, hypertriglyceridemia, stress, and statins don't address that. And when you look at the absolute risk reduction, if you take 100 men with mild to moderate disease, and you put them on statins for 5 years. Over 5 years, those 100 men are going to take 182,500 statin tablets with all the expense and muscle pain that will deliver to them. For what result? You'll avoid one heart attack, maybe two. For all that pharmacology and all that expense. If they have established disease, you'll prevent 4 or 5 over those 5 years. Statins really aren't the answers. And the other problem is it gives the patients a false sense of security that, oh, my cholesterol's down to 128. I can eat all the burgers and fried chicken I want. Well, that puts the patient in the pitfall of the paleo eaters who get an initial response because they stopped eating the dairy and the flour products and the oils, which no caveman ever ate, and I agree with. But a steady stream of animal flesh, in my estimation, is a recipe for an epidemic, certainly of colon cancer from all the carcinogens smearing on the gut wall. From the TMAO that they're going to generate, they're going to have a harvest of heart attacks and strokes. All the endotoxin they're going to eat will give them leaky gut that's going to open the door to lupus and autoimmune diseases. As they're going to show you all the saturated fats going to clog their arteries, their insulin receptors, going to get type 2 diabetes. They'll have rampant Crohn's disease and colitis from the gut bacteria that the diet spawns, and their blood vessels in their brain are going to be badly damaged by the oxidized cholesterol, etc. This is a recipe for disaster. I think the Ozempic users are going to get fat to say, oh, well, listen, wait, I can eat all the fried chicken I want. And again, I think these are deals with the devils here. If you want to heal your arteries, then take a tip from the gorillas. They're a whole food plant-based diet. Gorillas do not develop atherosclerosis in the wild. They do not develop ulcerative colitis. They don't develop type 2 diabetes. And we should take a lesson from them. Quickly, type 2 diabetes reversible. Dr. Sweeney at Yale gave half his medical students a high carbohydrate diet, sugar, candy, pastries, white bread, baked potatoes. And for 2 days, did a glucose tolerance test. They all handled sugar very well. It did not affect their ability to handle sugars. Sugar is not the cause of type 2 diabetes. But the other half of his medical students, he put on a high-fat diet, olive oil, butter, mayonnaise with egg yolk, cream, and did a 2-hour glucose tolerance test 48 hours after that fatty diet. And every one of the students were in the diabetic range because their insulin receptors get clogged up with fat. The problem in type 2 diabetes is the fat, not the sugars. The high sugars are the tail of the dog. They're the result, not the cause. Here you see a muscle cell where the intramyocellular lipid is accumulating because of the constant fat in the blood. This is not theoretical. This is what it looks like under the light microscope. It's black stuff. It's fat in the muscle cells. Here it is under the electron microscope. This is fat in the muscle cell from a fatty diet. And what it does, you probably are familiar that when insulin plugs into the insulin receptors, 2 kinase enzymes, this K here and this K here, are activated, and that activates the GLUT4 transport mechanism that pulls sugar into the blood. That's into the muscles to be burned. That's how it's supposed to work. But if you've got so much fat in the muscle cells, they get oxidized to free radicals and ceramides, and these kinase enzymes get inhibited, and insulin knocks on the door, but nobody answers, and sugar piles up. But the high sugar is the result, not the cause of the diabetes. Studies now illustrate this mechanism. And so here you see the person with type 2 diabetes, the muscle cells have their insulin receptors clogged up on the inside from the fat. And this, of course, explains Dr. Sweeney's fatty diet medical students. But if the patient happens to have a protuberant abdomen with lots of visceral fat, that adds another layer of problems because that fat is not benign. It produces inflammatory prostaglandins like interleukin 1, interleukin 6, and that sets off inflammation throughout the body. It's called metabolic inflammation. And people who say, oh, you can be fat and still be healthy. I take issue with that. I think obesity is a state of inflammation. And it's called metabolic inflammation. It is recognized in the journals here. And so now here we have the muscle cell of an obese person on a high-fat diet. Their insulin receptors are clogged up on the inside from the intramyocellular lipid, but the insulin receptors are interfered with on the outside by the inflammatory cytokines. No wonder so many obese people develop type 2 diabetes. Fortunately, this is a reversible disease. There have been studies clearly showing that a whole food plant-based diet will let the person burn the fat that's already in the muscle cells for energy. The interfering prostaglandin or cytokines dissipate. And the folks on the plant-based diet wind up, compared to the Diabetes Association diet, better improvements in their A1C, they lose more body weight, their lipids improve, their kidneys start to heal by leaking less protein. And I have patient Jim, 100 pounds overweight, on 30 units of insulin, 2 years on a plant-based diet. This Jim lost his 100 pounds, lost his diabetes, now running marathons. And you learn how to de-prescribe these potent medications. In this age of Ozempic, I have to shake my head. All these people really need to do is eat a whole food plant-based diet. It's mostly fiber and water. The calorie density is so low, you get lean automatically. If you go back for a third bowl of vegetable soup, who cares? It really doesn't matter. It's really the definitive treatment for obesity. It's an anti-inflammatory diet. Folks with lupus will find they often improve. I urge people with autoimmune diseases to get Dr. Brooke Goldner's book, Goodbye Autoimmune Disease. She put her own lupus into remission with a plant-based diet. The red tide is not friendly to the gut walls. It sloshes through the intestinal tract. It's filled with these substances that set off Crohn's disease and colitis. But again, it too will respond beautifully to a plant-based diet, which is much more soothing to the gut wall. The asthmatic folks wheeze less due to its anti-inflammatory properties. The psoriatic folks notice their skin clear. Do you have to be 100% plant-based to gain health benefit? No. The further you move in that continuum, the healthier you're going to be. And some people who've been eating meat 3 times a day for 50 years, they may have a real dependency on this stuff. They may need to taper it off over a few months. That's fine, as long as they're moving in that direction. Yet most doctors are totally oblivious to this. They have primary care, get the patient diagnosed and get them on the right medicine or shuffle them off to the right specialist. When I would talk to my patients, why does my doctor know anything about nutrition? We're not taught about it. It's not respected as a clinical science. They're eating the same burgers and pizzas in the cafeteria. So diet's never mentioned to the patient. Business as usual. Well, business as usual is a losing proposition for everybody. The patient loses the opportunity to really get rid of their disease. Every week I say these wonderful words to patients. I'd like to get rid of your hypertension. I'd like to get rid of your type 2 diabetes. I'd like to get rid of your lupus. I'd like to get rid of your ulcerative colitis. Those words are seldom mentioned in American medicine. And so the patient loses this powerful opportunity to get truly healthy. The doctor loses the best patient satisfaction, practice satisfaction of all, seeing their patients get leaner, healthier, and off their meds. The healthcare system loses trillions of dollars every year treating these diseases so people can go out and eat more cheeseburgers. That money could be used to send kids to college, to put internet in everybody's house, to fix the roads. It's such a black hole to put our wealth down, treating these chronic recurring diseases from what patients are eating. Every time someone goes down with a heart attack or stroke, society loses not only a creative person, but a taxpayer who's helping foot the bill for our prosperous society. The farm animals lose big time. 80 billion of them every year get their throats cut because we like the way their flesh tastes on a bun. And animal agriculture is the main driving force why we're cutting down the forests, why we're depleting our water, we're polluting our rivers. The planet loses. Business as usual is a losing proposition. When I talk to my colleagues, they say, listen, I don't know what to tell them about nutrition. I don't get paid to do this counseling. I don't have time to do this counseling. You don't have to, doctor. There are trained professionals, plant-based dietitians who will be happy to do this counseling for you. Connect with one in your practice, and when you see the patient, get them on the right medicines, etc. But say, I want you to make an appointment with Miss Wilson. She's the Plant Smart dietitian. She's going to talk to you about what to eat.
We have questions.
Going to give you articles. She's going to show you videos. You eat like she's telling you, and you come back and see me in a month. Let's see if they're not leaner and healthier. Wherever you look, you'll find plant-based dietitians. So what I'm proposing to the medical students and the young doctors is a new model of medical care, where the dietitian is brought onto the primary care treatment. We've been holding her at arm's length as an afterthought. She has a proper deserved place on the primary care treatment team if you want to get these patients healthy. At the Lifestyle Medicine Clinic I've joined up in Victoria, BC, that's exactly the patient flow. The patient sees the doctor, step 2 there, and step 3, the next stop is the plant-based dietitian who gets them on a plant-based program, and we follow them up. So, physician, educate thyself. Where are you going to learn about this? And patient, educate yourself. Fortunately, there's a lot of free information. Go to plantricianuniversity.org. Dozens of courses await you there for the taking. The American College of Lifestyle Medicine have wonderful food as medicine courses. The University of Winchester has an online 6-week course on plant-based nutrition. I took it, great course, highly recommended. There's wonderful books now, Plant-Based Nutrition Clinical Practice. There's a medical journal now, an official international journal of disease reversal and prevention. It's a thing, and we need to learn about it. And it's, if you want to heal your patients, this is what you need to learn about. People, Americans aren't going to change what they eat. They do change. They're tired of being sick and tired, and it's the 21st century. So how do you get started, doctor? See this film. Go to forksovernines.com and see that film, and then go back to their website. Go to nutritionfacts.org and start seeing videos there from Dr. Greger. Read this article, Nutritional Update for Physicians on Plant-Based Diet in the Permanente Journal, and download PCRM's nutrition guide onto your cell phone. So if you've got a patient with hypertension, you'll know what to tell them. And again, for the patients, get this little book. I have no connection with the finance of this book here, but she wrote such a sweet little book to get people started on this wonderful program. So it's easy to get started. Take a picture of this one. There are There are jumpstart programs. Rochester Lifestyle Medicine's got a great one. Forks Over Nine's a good one. PCRM is a good one. It's there. You've got allies to help you make a move. Because if you don't, doctors, then you're condemning yourself to be like the blind men and the elephants, and the specialists are in their cubicles, and the cardiologists treating the clogged arteries, and the endocrinologists treating the diabetes, and the gastroenterologists treating the Crohn's. And they think they're treating different diseases when the reality is they're all treating the effects of what their patients are eating. It's the food, it's the food, it's the food. And the tragedy is that a whole food plant-based diet will reverse these diseases. Well, where are you going to get in the villages here? Where are you going to get this kind of food? Any restaurant these days, you can make a plant-based meal happen in an Italian restaurant, pasta with vegetables. And you get vegetable curries in the Indian restaurants. You get plant-based tacos and burritos in the Mexican restaurants. You get noodle dishes in Asian restaurants. It's doable. You can't take no for an answer. They say once you look behind the curtain, you can't pretend you don't know what's behind the curtain. And my job is to tear down this curtain, tell you it's the food, it's the food. So at the end of this presentation, I ask the students and the professors a provocative question. Knowing how reversible the major lethal degenerative diseases that you are spending the majority of your medical career treating, knowing how reversible they are with a diet of whole plant foods, question, want to heal these patients? They just want to manage their chronic disease. They're just going to manage their diabetes, manage their hypertension, and hope they don't have their stroke when you're on call. You're going to leave medicine. It's a dismal way to practice medicine. I'm the scout who's been on the battle for 50 years, and I'm reporting back to front lines to the reinforcements just coming into the battle with a couple of messages. One, it's the food. It's been the food all along of your patients. And second, these are largely reversible diseases. I wish someone had told me in medical school that hypertension is reversible. I wish they told me type 2 diabetes. Well, these are reversible diseases, and a plant-predominant disease is the key to their reversal. Now, to the students, be cool. Don't go into outpatient clinic with an attitude wagging your finger at your professors. Don't you know you're killing your patients without talking about diseases? These are disruptive concepts that are going to take time to infiltrate into the medical practice establishment. But it starts with awareness of the practitioners, and that's what I've been trying to instill in you. So the last slide just tells you that a new era in medicine is dawning, and the plant-based wave is breaking. Line up your surfboard. Disease reversal is the goal. It should be the goal of your patient and for the practitioner. And again, at the Plant Nutrition Project and the ACLM, there's plenty of help available. And there's help available right here. You've got the Whole Food Plant-Based Club of the Villages. Get to know these folks. They will give you guidance and encouragement and help you take those important steps to a truly healthy diet and lifestyle. So thank you to the Whole Food Plant-Based Club and Villages for bringing me in to deliver this very rapid-fire machine gun presentation. Sorry for all the dense, rapid information here, but hopefully some of you have found some information that will be valuable to you and your patients.